Today is February 2nd, 2006. We're at the home of Dr. Donald Dilworth in Escondido, California. Please, can you introduce yourself and briefly tell me where you were born and a little bit about your childhood?
You want all that done within a half hour, do you?
Just briefly.
But very briefly, I am Donald Dilworth, a native son of California, since my father came to California in the early days on horseback, and went to college where he took his education in agricultural studies. So he went out to Hemet to start a farm and a dairy, and so I was born there along with my twin brother, and of course we were in Hemet, California up until we left for college.
So what schools did you attend and where?
Well, all the high school was in Hemet, California. Then after that, I went to what was known as the Bible Missionary Institute in Los Angeles, where I got interested in missions in general. And that was only for 2 years. And then went to Chaffey College for my pre-medical studies, which was for the next 2 years. And that was at the time when World War I began, so we were in a lot of troubles.
When did you decide to become an osteopathic doctor?
I was probably influenced as early as my high school days, because we had a local DO who was part of our family physician at the time at Hemet, and he was also very active in the church there, so that due to this good friendship and relationship, I was interested in the profession.
When and where did you meet your wife?
When I was working for a group of doctors in West LA, and she was attending the Bible Institute of Los Angeles at the time, and through a mutual friend, when we met at this clinic in which I was working, is when I became acquainted with her.
That's nice. What osteopathic college did you attend?
In those days, we would say I attended the most famous one because it was the only one in the West. And being in the West, it was the College of Osteopathic Medicine and Physicians and Surgeons in Los Angeles.
And where did you intern after that?
And then, with a little special searching, I was accepted at the Magnolia Hospital in Long Beach for my year of internship.
In March of 1948, delegates from the Committee for the MD degree were sent to Bakersfield Convention there to campaign for legislature to procure a usable degree from the College of Osteopathic Physicians and Surgeons, and to make the college an osteopathic medical school. Did you participate, or were you aware of this at the time?
The rumors and the problems had developed between the two professions by along about the end of the war, 1945 and 6, of course. But in 1946, I had gone back to New Jersey to get a license in the state of New Jersey in order that I could practice there while I was attending Princeton Seminary. So I was out of the state at the time that the primary struggles went on up in Bakersfield.
Okay. So,
but the rumors were going back and forth.
So you didn't experience any type of discrimination?
Not at that time.
Okay. How did you get interested in serving a medical mission?
To be interested in medical missions goes back quite a ways, and of course it goes back to our family, because my folks were often entertaining medical, just missionaries in general, particularly from India and Africa and so forth. So you can imagine that when my older brother went to Africa as a missionary and my twin brother went to China, I had to be able to make some decisions, so I had to take the next one and go to South America.
And at that time, were you married when you went on your mission?
Yes, because we got married right at the end of my internship, so that meant that it was my wife and I when we went back to New Jersey, and that's where we established our first home.
Okay. What was it like being a medical missionary?
Oh, it was very exciting, primarily because we did choose to go to the highland Quichuas of Ecuador, where formerly known as the heirs of the Incas in their large numbers, and yet they were so dominated by the government with its strong pressures that they weren't sympathetic with anybody that looked like a white man and so on. And so it was a bit of a pioneer effort to break into their society, and that's why it was the medical work that had to go to work for that.
Did you raise a family while you were living there?
Yes, we had. That goes back a little far, doesn't it? Because we had the first two children were born when we were in New Jersey, and the third one was born while we were in language study in Costa Rica. So that meant that we had the three with us to live in Costa Rica, and then Ecuador, and then the Nancy, the last child, was born in Ecuador.
Interesting. And what type of work did you do there?
Our work was to simply introduce clinical service to 3 different groups of these highland Quichuas, so that we built 2 small clinics, and then the larger clinic, which developed into a small hospital with about 12 beds, so that we were able to break down the prejudice against all of the foreigners in those 3 areas, in which we were then able to establish the first churches.
Was it difficult raising your family while you were there?
I only smile because of the fact that the biggest difficulty was that they had to go to the capital city of Quito to go to school, so that that meant that we were separated for about 9 months out of the year. So I guess you'd call that a hardship.
When you returned to the U.S., how long had you been in Ecuador?
We had been in Ecuador for 16 years.
Okay, what made you come back?
And so it was time to return, primarily for having 3 of the children who were ready for college. And it was necessary for them to have their college education up here, of course. And the biggest problem then is that how do you finance the 3 children in college? So I had to go to work.
Okay, and where did you start working? Where did you practice?
So I was returning to California, and of course my license was still active. And so I simply told the family that they could go around the state and see where they wanted to live. And when they found the place they wanted to live, while I was doing some graduate work at the Fuller Seminary, why, they went exploring, and they decided that Escondido was halfway between the ocean and the mountains, and that should be a good place to live. So that was where I would be able to practice.
In the early 60s, because of the proposition that was passed by the California voters, licensing of DOs ceased. How did this affect you at that time? And basically, how did it affect you? Or did it not?
The effect of the pressure that was put on us was, I was aware of this when first returning to California, and then I started receiving telephone calls from a group of lawyers up north of Los Angeles wanting to know why I wasn't using my MD degree. I had the MD degree that had been offered by the new combination since a special friend of mine had paid the money for it when I was out of the country, which I hardly knew, but I recognized I had it, so my name was on their list. And so I got telephone calls at least every 2 weeks for the first 3 months wanting to know how come I wasn't using my MD degree. And so I simply told them that I was too proud of the profession and that I was going to only practice under the degree because they weren't going to let you use both degrees. So that's the reason I ended up loyal to the profession.
Now, at this time, were you associated with the Osteopathic Physicians and Surgeons of California?
Yes, of course. As soon as I returned to California, I immediately reactivated my membership into the state association.
And I understand you served on the board of directors of that organization?
It was not, that would be 1968, and it was 1972 before I became active as far as being made a part of the board of directors for the state.
But you were also president of that organization.
Yes, I was president, I believe, in the year 1977.
Was it this organization that actually solicited the AOA for a new school in California?
I smiled just a little because of the fact that by that time we were very small in numbers. And so anybody who was active had to have some position of an office. There was no competition in terms of anybody looking for an office. There was simply anybody who was even active was going to be given an office. So that meant that we immediately went to work on it, but it was the contact with various people around the state that led us to the recognition and the need of a new osteopathic college. And of course, at the same time, we were making inquiries into the neighboring states. And we got great encouragement from the states like Washington, Arizona, and Oregon particularly, so that it was a bit of this feeling among all of the western states that led to putting the request back to the AOA.
Now, which of the founding board members of the School of Comp were the organizers?
Well, the primary leadership, of course, came from Dr. Eby first, and then Dr. Fryman was one of the strongest ones, but Dr. Allen was the one who probably knew the broadest extent of the membership for our state association. So among those three, you probably had the strongest combination that was really effective.
When did Frank Carr, how did he participate with the board?
I never knew Frank Carr in a personal way, but he was simply an advisor, especially to Viola and Dr. Eby, in terms of the not only the authority from the state, but also following the local demands of our situation.
So how was the board of directors chosen, or were they elected?
As I recall, it was more a case of any of us who were willing to apply and accept the job They would be glad to have us on the board, so that anyone who applied, because I don't really recall anybody that was really rejected.
I've noticed that Stephen Case is mentioned in certain records as being involved in founding the school. In what capacity?
I had become acquainted with Stephen Case through his family, through part of the medical service, and since he was the president of a college in California, he became a good advisor, and he had been responsible for the organization of part of that college, so we felt that he would be a good advisor to helping us start a new college.
I'm also curious about the proposed names prior to the adoption of College of Osteopathic Medicine of the Pacific. There was mentioned in some records Academy of Osteopathic Family Medicine and Western States College of Osteopathic Medicine.
Well, when we had done these interviews and we began to get encouragement from Arizona and Washington, that was why we had a pretty strong feeling that we would like to have the name Western College, because we were representing especially all the Western 5 states. And it had a good possibility, but it was a pretty long name. So I think that was the only reason that we ended up more with the name of the college as it is today.
So I understand you were chosen to interview Dr. Pomerantz. Can you tell me a little bit about that and how he was chosen?
We had from the state here,